So we're going to talk a little bit more about eradication as a strategy. So again, we've talked about the vaccine. We've talked about the polio virus in of itself. We've talked about the clinical manifestation of the polio virus. We've talked about the history of the polio and polio disease. And we've also talked about the two vaccine and two different types of vaccine and the relative advantages and disadvantages of these two different types of polio vaccine. And indeed, because we have the vaccine and because we have resources and ability to surveil and to detect cases, eradication in of itself is a strategy. It's a major strategy that is made possible because of the availability of the vaccines for polio. So we'll go back to the discussion around the debate between control versus eradication. So let's think about polio as an eradication strategy. Again, the goal to eradicate polio. So why eradication? Why not other types of goal? Why not elimination? Why not control? There are different strategies or there are different goals that you can aim to achieve for addressing an infectious disease like the polio. So one is control. Control would be the scenario where you bring down the disease to an acceptable level. So that is to say, yes, the disease is still occurring within the population, but you're able to reduce the morbidity and the mortality due to the disease to an acceptable level. So for this, you require ongoing prevention measures and treatment measures to curtail the disease. And this is different from eradication, which is really the goal to completely eliminate the disease-causing agent from the face of the world. So you really want to eliminate the incidence of the disease to zero. So that is to say that no individual, no one on earth will be able to get the disease. And if you're able to achieve this, you can actually stop the preventive measures, unlike for control. You can stop vaccination, you can stop treatment, and so on. So all preventive measures can permanently end. And elimination is very similar to eradication. And the only difference is just that you achieve the same as you achieve under eradication, but within a limited geographical boundary. So either within a country or within a region. So why eradication for polio? Why not control? Why not elimination? And the answer to that really goes back to some of the criteria for or indicators for eradicating a disease. So one of the things about eradicating a disease is that you really want to be sure that eradication is possible. And eradication is possible based upon the biological consideration of the disease, including the fact that humans should be the only reservoir for the disease. So that once you eliminate the disease among human population, then you would have achieved eradication, and there's no chance of amplification of the disease-causing agent within the environment. So earlier on, it was thought that polio existed among only humans, and it was also thought that the polio virus can only amplify within humans, and therefore eradication was set as a strategy. Even though as time went on, we begin to understand the biology of the virus even more, and there are reasons to believe that the virus can, in some regard, amplify within the environment, either in the human host or just in close proximity to the human host. And this actually presents challenge to the eradication goal. And then again, the other notion is that you should have commitment, political commitment across different countries, across different regions at different levels in order to achieve eradication. And all of these were in place as far back as in 1988 when the Global Polio Eradication Initiative was set. And over the years, there's been a lot of dynamic changes in our understanding of the biology of the disease. There's been a lot of changes to the commitment, either at the political level, in terms of leadership, at country level, at national level, at regional level, and so on, that has really questioned the eradication goal for the polio program. But again, the program is closer to achieving eradication, given that over 99% of the cases have declined for polio over the course of the 30 years that the Global Polio Eradication Initiative has been in place. Eradication is really difficult, as you can imagine. I mean, it's not just for you to have a vaccine. It's not just for you to have an effective vaccine. The vaccine has to be delivered. So there's a lot of implementation consideration that has to be thought through in terms of delivering the vaccine. And then the vaccine has to be delivered to all children or all eligible population across the world. So you have to do that across different geographies, different boundaries. And then you have scenarios where there is different governance structures and political structure in different countries. So you have to work within those political contexts. There are different cultural beliefs, different societal norms. You have to work within those societal norms. You have to overcome barriers or challenges that are posed by that. And then there are different individuals that are involved, right from the parents, the caregivers, to the health worker, to the administrator at district and regional, at national level, to actors at global level, and so on. So you have all of these working together as a complex system. So eradication programs are difficult because it requires implementation within a very complex system. And therefore, there have been very few examples of a successful eradication program. So we know that there have been at least 7 different programs that have been candidates for eradication, or diseases that have been candidates for eradication. And only one of them has succeeded, and that's the smallpox eradication. And the smallpox eradication is unique in of itself because of the nature of the virus that causes smallpox. It's the DNA virus. It's more stable than the RNA virus that causes polio, for instance. And there are clear clinical manifestations for smallpox in most of the cases, or almost all of the cases that get smallpox. So you're able to identify cases, you're able to quarantine cases, and really certain preventive measures in addition to the vaccine. For some of these other diseases, they don't have some of those clinical properties. So for polio, for instance, we did say that in majority of cases, you don't see the infection. So it's really therefore it becomes difficult for you to identify cases, to isolate cases, and so on. And then for some of these other diseases, there are other issues and challenges. The eradication goal has failed. Eradicating diseases or setting up an eradication programs are indeed very difficult. And the polio program provides us with very useful lessons for our future eradication activities and also for the global health programs. Like I mentioned earlier on, polio is harder than the smallpox to eradicate for some of the reasons that I described. One, the biology of the virus. So smallpox virus is DNA, and DNA viruses are most RNA viruses. So the extent to which they change genetic material is less frequent. And therefore, vaccines are able to confer protection, and the risk of regaining virulence as we have with the polio virus is really unlikely for the smallpox. And the second thing is the clinical manifestation of smallpox. It's classical. You see rashes, patients that are healed, and this allows you to readily identify cases and to isolate cases and to quarantine the cases and the close contact to the cases. And you can put in other measures outside of vaccination to control the disease. And this helped with the eradication of the smallpox. Unlike the polio, in that it's not every case that has polio that manifests. So you really don't know, and therefore it becomes difficult for you to isolate, to quarantine, and to do ring fencing immunization, as was done with the smallpox eradication. So again, the biology of the virus itself, the clinical manifestation of the virus, and then also eradication needs to happen within a time-limited fashion. You can imagine that when you are trying to achieve eradication and this becomes protracted, people's attention wanes, commitment wanes over time, resources also wanes. So it becomes more challenging. And that's one thing that have happened to the polio program. There's been a lot of challenges over the years, which has really impacted on the commitment, both at the political level and the implementation level in specific countries to sustain the effort. There are other examples as well, but I really want you to take a pause and reflect on some of these issues, comparing the polio and the smallpox eradication initiative. Again, just to emphasize that polio eradication is truly an enormous endeavor that requires coalition, collaboration at the global level. So you need to think about in terms of the scope, the time, the resources. It requires implementation of evidence-supported intervention across different settings, both social, political, economic setting. It requires activities and coordination at various levels, at the global level, at the regional level, at the national level, at the subnational level. It requires many actors. So here you see, in this picture, you see a health worker administering oral polio vaccine to a child in a train in India. And indeed, you see that there's a lot of people involved. So from the parent of the child to the health worker, to the supervisors, to the district officers, to people who do surveillance, to political leaders who make policies at different levels. So there are different actors that are involved. And because of the peculiarity of the different contexts, it also requires different forms of strategies to facilitate and to overcome barriers across different contexts. So eradication as a strategy, eradication as a goal, it's an undertaking that is not to be taken lightly. It's something that requires the best science, the best knowledge to implement, and also commitment over time across different levels. This slide is really for us to highlight how the global polio eradication campaign has intensified in recent times. So you would see that like between 1988 and 2008, the Global Polio Eradication Initiative achieved a rapid decline in the number of cases of polio from about 350,000 cases to about 1,500 cases. And then between 2008 to 2018, it was a lot harder to reduce the cases because of specific contextual issues within specific population. So over that period, activities for mass immunization kind of ramped up rapidly. And this slide and the map that you see really shows to you how campaign, that is to say, activities by which we, vaccine workers and health workers go from door to door or go to specific location to immunize, to deliver vaccine to children intensify over time. So you will see the intensity is shaded by the color. So looking at the African region, you will see that the darkest shade of blue is really where you have about between 5 to 9 campaigns per child. That is to say that a child in that year received a vaccine from campaign program that requires a health worker to go door to door, house to house, or from location to location about between 5 to 9 times within the year. So indeed, it shows to you the scale of what it will entail to achieve that. I mean, and this occurred in places like Niger Republic, in Africa, as you see, in West Africa, one of the darkest shade, in Chad, in West Africa, in Sudan, in part of North Africa. And then the next dark shade of blue really shows to you where the campaign occurred between 3 to 5 times per child. And then the lighter shade, we had about 2 to 3 or between 1 to 2 campaigns per child per year. So again, it shows to you the intensity. So not only do you have to set in all of these actors, all of these mechanisms, alliance for a particular point in time, you have to do it repeatedly, over time within the same population. And therefore, given the nature of the disease, it's really important that no child is left out. It's really important that every child that is susceptible, every eligible population receive the vaccine. So you have to achieve perfection, even given all of the challenges that are posed by the different contexts in which the program has to be implemented. Because just missing out one child, missing out 2 child, or missing out a couple of villages will hamper the eradication goal. So there's a zero allowance for omitting any child or any population. So therefore, for eradication, to achieve eradication as a goal, in order to extinct diseases from the face of the earth, perfection is essential. And then to think about achieving perfection across different contexts and across different boundaries really allows you to see how difficult and how challenging the polio eradication initiative has been. Despite these challenges, there has been a lot of success, and we will hear more about some of these successes even as we go on in this course series.